With the Cardiff Half Marathon coming up next month, we've seen a real influx of runners coming into the clinic with common complaints with ankle and knee pain. And a really common misunderstanding when it comes to running is the mechanics of the foot and essentially footwear. Because many people are told that they have an overpronation. And pronation just refers to the flattening of the arch, which should occur as a normal process in the gait or walking cycle. And so if I have a normal arch in my foot, what should happen as I move is that arch should be able to flatten, but then equally be created into an arch again. And so it's the movement into one position and then back to the other that matters. The idea of having too much of a pronation, frankly, is a myth and not really a true thing. Instead, the problem lies when I'm stuck in any one position, whether I'm in a rigid arch, which is called supination, or a more flat foot, as a pronated foot, is fine as a starting position. It doesn't matter if you have a flat foot or a rigid arch. All that matters is through that cycle of movement, doesn't matter what the starting position is, but it's able to move into one and back to the other to create a loaded spring effect. Because in order to create momentum and propulsion in running, it's all about creating this pronated position, which is loading of the spring and then using the arch to propel us forwards. So don't worry too much if you're being told that you overpronate. Instead, you need to be able to assess, can I actually move my foot in both directions? So that's really important. Because if you're presenting with the common injuries that we see, like Achilles pain and patella tendon pain, it's often because the patient is stuck in one position. And so if they are in a pronated position 100% of the time, there's a chronic stretching of the Achilles where the foot is in that position. And so it never really gets a chance to contract. Instead of the muscle then transmitting force, the tendon has to take over. And so it doesn't matter how much rehab we do on the tendon, unless the foot has the ability to move through all directions, you'll keep getting injured.